so I'd like to welcome Dr. Bird.
All right, thank you, Stephen. So before I get started, I would like to introduce a few special guests I have here tonight. These are actually patients of mine that I have here that I've completed dental implant work on. And they're here as testimonials, so some of you may have met them already and talked to them a little bit. But if you'd like to ask them, if you have any questions about the procedure yourself, I'd much rather you ask them than ask me because they've gone through it. They can see it through your eyes. So I have Mr. Don over here. Mr. Don, you want to stand up? So Mr. Don, we placed some implants in him. So I believe we placed 4 implants with some fixed permanent crowns on there. So Steve, I think he had 3 implants as a crown. Miss Jacqueline in the back. So she has 4 replaced teeth on the top with multiple implants. And I want to mention they're not being compensated, so they're here of their own will. And if you were told otherwise, you were lied to. All right. So let me go ahead and get started. So tonight, the name of tonight's seminar is Change Your Smile, Change Your Life. And sitting in front of you is a folder. So if you look at that folder and inside of it, there are a few things in there, some coupons, but we have special going on. We have a Smile Protection Plan brochure, which is our in-house membership plan for the patients who don't have dental insurance. This is how we can make it a little more affordable for you. And if you'd like to come in to either our Kenner or Guerrero office afterwards and get your free implant consultation, including any x-ray and CT scan, take the time to fill out this front and back, and that'll save you some time coming in, okay? And even before you leave tonight, we have the ability to actually schedule you. You can go online and schedule you today for your consultation appointment. And everyone should have gotten a little red ticket when they came in as well. So make sure you stick around to the end. We're just going to give away some free prizes, okay, including the very last one, which I'm sure you're all going to love. So without further ado, we'll get started. So I told you I was a 2001 graduate of LSU, and I've been practicing dentistry in the New Orleans area ever since. And around 2007, I started to focus what I do mainly to implants, and now that's all that I do, 100% is implants. So if you come in, you'll see me from the consultation to the surgery to the restorative to the follow-up. So that's one advantage I feel that you have. Most places you go see a dentist, and they say, oh, you got to go see a surgeon. You go to the surgeon, get the implant done, you go back to the doctor to get the restorative done, and you kind of going back and forth between the two. Well, when you come into our office, you're going to see me from the beginning, from A to Z. Consultation to surgery to restorative to restoration. Back in about 2009, I got more involved in education. So actually, I do a lot of speaking for implant companies, for imaging, CT, and X-ray companies across the country and even across the world. And around 2009, I was planning on going to help teach a course in El Salvador. And like the weekend before we were supposed to go, we got word from the government that they canceled our trip. They wanted to delay it like 2 weeks, but we had 12 doctors coming from all around the country to learn how to do these surgeries, and logistically we couldn't reschedule it. And I was actually in Las Vegas when they canceled it at a meeting. And over the phone, I called up Karen, our office manager, and she got us a bunch of patients to come in. And we actually did the course here in New Orleans. We did like a free implant course. We did free implants to patients and had all these docs learn how to do these surgeries in our office. And that was my, I guess, first time doing a course in my office with doctors. Now we kind of regularly do it, and we teach other doctors how to do these procedures. And I'm going to show you a little video here. It's going to explain a little to you. Not going to explain anything. It's going to show you some press coverage we got on that event back in 2009.
Dental care in Central America is rerouted to Louisiana. WGNO's Vanessa Bolano says dentists and oral surgeons are restoring lives one tooth at a time.
Suction devices and drills. 2 sounds that make most of us cringe, but not here, not today.
It's going to be great to actually fill that in and have it in there again.
All week, dentists are in Guerrero, learning and giving back. Their Goodwill Mission trip was originally scheduled in El Salvador, but late last week, the government said they were no longer welcome.
We originally had 10 doctors scheduled to go to El Salvador, but 6 of the 10 were from the New Orleans area, and that's the reason why we decided to relocate here.
Imagine relocating something like that took months to plan in 2 days.
The decision to relocate to Marrero may have been a last-minute one, but doctors here say it's a success. They're doing about 14 oral surgeries a day, changing people's lives.
So you can imagine after that aired, we got like about 400 bazillion phone calls wanting for implants. So that was back in 2009. And as I go forward, we'll get more into details of the implants now, but I want to emphasize that, again, this is for you, each and one of you individually. So please feel welcome. If you have questions, please stop. Steve has a microphone here. We can go bring it to you and let you answer your question. If it gets to where we got too many questions, I may kind of say, let's wait to the end, but as long as we can kind of keep them without getting overloaded. So y'all seem to be a pretty relaxed crowd, but typically I go around and give everyone a little massage before it starts, but the crowd's a little large, so instead I'm going to show you this video instead.
I really don't get out too much, You should. It would do wonders for your muscles, your shoulders, working your buttocks, Yeah, I'm not really doing more around down there. Okay, well, I'll move up here, there's no problem. I'll keep on the up and up, but I could do wonderful, wonderful things for you.
All right, one more video. All right, so now we go ice. We're getting to some more serious stuff. So you're about to discover how and why a transformed smile can literally change your life. And that's no joke. I've had many, many patients have come in and have literally brought to tears about how the power of dental implants and what we've been able to do for them has changed their life dramatically. So implants was once a top secret of the rich and famous, but now they're more affordable and more readily available for everyone, including you. So you might ask, why would we have an informational seminar? Well, quite simple. It's to give you the necessary information that you need to make an informed and intelligent decision on the numerous dental implant options, and even options that do not include implants. So I have to ask, have you ever wondered, what would it be like to smile with confidence at the people you love, for those of you with missing teeth? What would it be like to eat your favorite food again at your favorite restaurant without pain or embarrassment? And how would it feel to look 10, 20, even 30 years younger? These are things we do for people every day. The benefits of dental implants, why partial dentures really don't work, why one size doesn't fit all, and hopefully how to reclaim your smile and eventually get your life back. There's never been a better time. Technology has never been better. And keep in mind, your mouth is in a constant state of deterioration. So no matter how bad things are now, they're not going to improve a year from now. They're only going to get worse. And if you wait too long, it's only going to be more expensive, and eventually may even be too late. So in all my years of doing this, the two most common complaints I get from people are, one is they cannot eat the foods they love or need for healthy nutrition. I don't know say for nutrition, they don't really, they leave that far out. Or for once in their lives, they want to have a smile that they're not embarrassed about. So there's two things. Function, they want to be able to function well, they want to be able to smile and have a good smile. And it'll look good. And the third thing is they always say, I want it to last too. It's important, right? That's the third thing here, but they don't complain about that. That's kind of afterwards. But even though they have those concerns, typically they don't know where to turn to. Where do I go for help? Who do I trust? They lack confidence to better go somewhere and ask about it. A lot of times because they're ashamed of their smile. So when we're missing teeth, it limits what we eat on a daily basis. It limits how we live our daily lives, both socially and emotionally. So no wonder missing teeth affect our lives so much. After all, we use our mouths for everything every day. We eat, we talk, we sing, we laugh, we're intimate with our mouth. It's the gateway to our body. So what happens to us physically as we lose teeth? So these are things we don't think about, but things happen as we're getting to tonight. Things that happen are we lose bone, the teeth become hyperextended, they shift. It helps us lead to gum disease. Your bite changes, which can cause joint problems. The sinuses drop. You get gaps between your teeth. A missing teeth does many myriads of things that we don't really think about. But it complexes our smile, complexes our ability to chew, and can lead to other problems beyond teeth. So one thing we have to realize is that when we lose teeth, we also lose bone. Typically, when you lose a tooth, 40 to 50% of the ridge, which is the bone that's basically, the reason for that bone is to hold the teeth in. And so the tooth missing, the bone really has no function from there. And so in that case, typically we see 40 to 50% of that bone loss of the teeth within 6 months. And that's irreversible. We can't get that back. The effect we see is your face collapses, you get rings around your mouth, and if you lose too much bone, eventually the bone gets so thin that nerves get exposed. The jaw can get so thin that eventually it could fracture. The bone just keeps on disappearing. Especially if you keep wearing a denture. You have a denture and you lost all that bone. Now, I see a number of people out here wearing glasses. So, for those who wear glasses, your glasses don't weigh very much. They're pretty light, maybe an ounce or two, I don't know, a few ounces maybe. But if you feel behind your ears, you'll feel like a dimple back there where your glasses rest. If you feel in your nose, you feel a little dimple there. And that's not very much pressure there. So pressure on bone causes it to resorb. Now imagine how light that glass is. Imagine having a denture in your mouth and all the force you're putting on that denture when you're chewing. You're trying to chew all your food. There's a lot of force being put on the bone. And so you can imagine how much that bone resorbs over time because of the force put on it. That's one of the great benefits of implants that we'll get into, is they actually prevent bone loss and preserve the bone. Missing teeth cause reduced chewing ability and function. So we can't eat foods like we used to. We can't chew with the same force we used to. We can't digest our food properly because we can't chew it properly. And dentures and partials only give us 20 to 50% of the natural chew function. So any of you out there who have dentures, and you think about it, when you chew with your dentures, how much force are you putting on that food compared to your natural teeth? I think 20% is kind of generous. You can't chew that food like you can your natural teeth. Implants, you actually are stronger than your teeth. Reduced function equals an increase in soft, starchy foods due to difficulty in biting and chewing on harder foods. So it affects your diet. And even those harder foods you used to want to eat, if you force yourself to eat them, you can't chew them properly. You want swallowing big old chunks of food, and you really aren't able to digest your food properly by wearing dentures. So here's a startling fact. Studies show that people who are missing all of their teeth have an average lifespan of 10 years less than their peers with teeth due to poor nutrition. So that one thing decreases your lifespan by 10 years on average. So to recap, missing teeth affect the way we live, dictate what we eat, affect how we feel, and in our minds, determine how people perceive us. So, what is the answer? Obviously, it's a gift for you, right? No implants. But implants aren't the only option. There's many options out there, but implants is the only option that's been deemed the standard of care for tooth replacement in modern dentistry. With dental implants, typically, if you have sufficient bone, or if we can get you sufficient bone, we can get you all your teeth back and function just like you did previously. Now, I'm not going to ask Don because Don just got his teeth in. How long have you had your teeth now?
Pardon?
How long have you had your teeth in now, the permanent teeth?
3 weeks.
3 weeks, the permanent teeth, right? So the permanent teeth have been 3 weeks?
Yeah, the ones you did?
Mm-hmm.
Yeah.
So how are those different than the other teeth? Are they any different than the other teeth?
No, when I smile, I have to stop and think which ones are implants.
When you chew, you feel the difference. Which ones feel stronger?
I have to really,
They feel like your real teeth, right?
right,
Steve, you've had the same thing, so tell us about, if you don't mind, I have to put you on the spot.
Well, it's been about 5 or 6 weeks now, I believe. And I forget they're in there. I mean, I think they're my real teeth. I mean, they feel natural. There's no hot or cold sensation. I mean, it really feel good.
Okay. All right.
Feel it yet?
Feel it yet?
Yeah.
Do you have any limitations on what you can eat?
No, none. That's the same. I mean, I eat whatever I want. I eat what I did before. I mean, it really feel good.
How do you feel as far as your biting power? Do you feel like you bite food less, more, the same?
No, the same. I mean, just like I did before. You know,
And I'll tell you, I have an implant myself, and I agree with you. I cannot tell the difference between that and any other one of my teeth. They're the same.
Right.
Now, these aren't implant dentures. These are regular dentures with porcelain crown on top of them. They're replacing a single tooth or multiple teeth, and they are just like your real teeth. Now, I don't want to sit here and say that we can do anything better than God himself, okay? But I will tell you this is about as close as we can do, because in a lot of ways, and again, I'm not advocating to remove healthy teeth and place implants in, but in a lot of ways, these are actually even better than your natural teeth, because they cannot decay. You'll never need a root canal on it, and they're made out of titanium. So they're gonna be they're gonna stay in your mouth to probably the day you die. They're more durable than natural teeth. Yes, ma'am.
The reason I want to know is the reason they're more durable is because they got a back fusion and they actually go and go around. Like people say, you do so much. How can you do it? And it's because it's stronger. Is that why they're stronger than your bite power? Because bone grows around where the implant goes in.
Yes, exactly. And I'm going to get. I think maybe the next slide or two is going to describe exactly that. So I'll explain that in a slide or two. And if it doesn't answer your question, ask me again. Okay. So what are dental implants? Dental implants mirror the structure of the original tooth. So instead of having a root, you have an implant. Why are implants the standard of care? Well, of all the different options to replace your missing teeth, only implants stop bone loss. Only implants stop teeth from shifting. Only implants increase your biting power. And only implants do not affect adjacent healthy teeth. So implants are nothing new. In fact, the ancient Egyptians used to use rocks, shell, and even gold as dental implants over 3,000 years ago. Wasn't very successful, but we see many fossified skulls with these shells banged into the bone or gold banged in, and I don't know how they did all that, but I can imagine it wasn't the best success rates. But in the 80s, starting in the 80s, they gained a resurgence due to higher success rates, and then today they're more successful than ever, due to increased technology and increased not only technology on the implant making, but also with CT scans. So now we take 3D X-rays and we see things in a 3D world. So in the past, and even now when you go to the dentist, you take X-rays and they take these two-dimensional X-rays. Well, it's hard to diagnose and treat things in a 2D field when we live in a 3D world. So I like to use it like this here. So typically when I have an implant consultant, I show people a CT scan of their jaw area. I like to use the analogy of an apple. So the X-rays that we use currently in dentistry, for the most part, they're 2D images. So you get a single view, a superimposed 2D image from one view. So if you had a picture of an apple on the wall, you can't turn around and look at the back of that picture and see the back of the apple. You can't turn from the top and see the top of the apple. All you see is a superimposed 2D image from one view. Whereas a 3D CT scan is like holding an apple in your hand. Without having to dismember your jaw from your skull, we can actually take the skull, the jaw, and look at it on the computer screen in 3D and move it all around. And I'll show you, I have a little video late. Actually, Mr. Don's, when I knew you was coming today, I pulled yours up, so I'll show you Mr. Don's CT scan, if you don't mind, at the end. So that technology, it's almost like cheating for me, because when I take this CT scan, I can actually not only look at your jaw in 3D, but I can, just like I have an apple in my hand, I can take an apple and slice it open and look at it in all directions and plan it out, and actually you can virtually place the implants in the software. So I can practice your surgery before you even go in there. So it's like when I go in to do your surgery, I'm doing it for the second or third time, not the first time. I know what to expect when we get in there. That makes things much more efficient and quicker for me, which means it's faster for you, and the least time you're open, the better your healing is. So all around, technology, not only in the materials of implants, but also the technology of the CT imaging has been tremendous in not only increasing the success rate, but also decreasing the healing time. So we talked about improvements in design and technology. So decreased healing times, increased predictability. So currently our success rate's in the high 90% after 10 years. So nothing in medicine is 100% successful. Nothing in life is 100% successful. But when you talk about dentistry, 98% success rate after 10 years is about as close as the 100% as you're going to get. So this is we talked about a few minutes ago as far as the term osseointegration. So this is the whole key to dental implants. Titanium is easily accepted by the body, and bone grows around these implants in a process called osseointegration. So it's like this almost. Imagine that you have a screw, and let's say you're going to put it in your bones like concrete, pretty much. So imagine going in your backyard and taking this big screw and setting it in concrete and let it heal, let the concrete set. When you go back in there and try to remove that screw, it's not going anywhere. It's solid. It's not going anywhere unless you go in there and chisel all that concrete up. The implant's not coming out. It's kind of the same thing here. It takes a little while for the bone to grow into it, typically 3 to 4 months. But after that bone grows into it, it's in there stronger than your tooth ever will be. Your tooth is held in to the bone by ligaments. So you got 1,000 little ligaments holding that tooth in. And those ligaments serve as shock absorbers. When you bite something real hard, the tooth kind of gives a little bit. It's like a little shock absorber. Implants don't do that. They're in there solid. There's no give to these things. So when I tell you have more binding power than even your natural teeth, that's the truth. Now that's not quite the case when you talk about denture retained implants. Denture retained implants kind of hold it so they don't come out. They don't give you the same. They give you much greater binding power than you have with a denture, but it's not quite as much of a power as it gives you with natural teeth or porcelain teeth over implants. However, as I alluded to earlier, one size does not fit all, and implants may not be the right solution for you. So let's explore all of our options for replacement of missing teeth. And when we go through this, we're going to go through it from a single missing tooth to multiple missing teeth to missing all the teeth in your mouth. All right, so let's talk about if you're missing a single tooth. What are your replacement options? So let's go through each one of them. One option always is nothing, right? You can just leave the tooth missing. You're missing a front tooth, you can go around with a missing front tooth. No one's ever died from a missing front tooth that I'm aware of. The first thing we can do is something called a flipper, or a one tooth or multiple tooth partial. Okay? So the benefit to the flipper, or the one tooth partial, is that it's the most economical. And that's about the advantage of it. It's cheap. So, again, I will tell you right at the back that if your number one concern is finances, then we'll work with you, we'll do what we can. And one thing I'll tell you is because I do everything from beginning to end, I will tell you that I find that most of the time we're able to offer much lower prices than most people around town on this. Okay? And it's done very, very well because it's all I do. And I take pride in what I do. But overall, the process is not cheap. It's not the cheapest option you have. And so, if your number one concern is finances, implants may not be right for you. So just keep that in mind right at the back. So I told you before that they're most economical. That's the benefit to it. The cons for it are, one, it's uncomfortable. You get all this plastic in your mouth to replace one tooth. It can irritate the gums. It moves and shifts when you eat. Food and bacteria gets caught underneath and causes bad breath. The clasp on them have to connect the teeth, and those can wear down those teeth, which eventually may lead to more tooth loss. You need to take it out at nighttime, and it may last 5+ years. And as you'll see, most of these bone loss continues because the tooth is gone. So the next option is something we call a fixed Maryland bridge. So the benefit to the Maryland bridge is that, one, that it is fixed, meaning that it's not removable, it stays in permanently, for a while anyway, for a little while. And it's still somewhat economical. To give you an idea, and again, I know people always wonder, okay, well, what does this cost? That's the biggest question. So I'm not going to shy away from that. I'll answer that question for you. I'll begin by saying that it's hard to answer because every case is different. It depends on your situation, how much bone you have. But let's say if all the conditions are ideal, I can give you some ballpark figures. So the first thing, that flipper, that might cost, I don't know, $500 to $800 in that range. Depending if it's one tooth, multiple teeth, maybe $1,000, maybe $500 and $1,000, depending on the situation. Something like this, a Maryland bridge, we just basically prep the back end of both teeth and kind of cement it off the back end. And it stays in permanently for a while, but eventually the bond gets loosened and it comes out. And if it comes out, we have to cut down the back of the adjacent teeth. The prosthesis, or this, looks almost like a back, doesn't it? Yeah. It's bonded to the back of the adjacent teeth. Bone loss continues. You can't bite on it very hard, like you could right out your teeth, or it may pop out. And chewing forces will eventually loosen the bridge. Lifespan, 5 to 10 years. So something like this, ballpark, might cost about, if I had to guess, about maybe $1,500, maybe? I'm guessing. $1,500, $2,000, maybe most. Okay. Third option is a fixed bridge. So in the past, this used to be the golden standard. So the fixed bridge, it looks very natural. It's permanent, it's not removable. And it may be okay if the adjacent teeth next to them need crowns already. But if those two teeth next to that missing tooth are in perfect shape, we have to shave down those teeth in order to get this bridge in. So that's one of the cons against it, is we have to cut down healthy adjacent teeth sometimes. And that leaves those teeth more predictable, more prone to perhaps get decay in the future. It could possibly cause a food trap. The bone loss continues. And the lifespan, 5 to 10 years. Now, when I say lifespan of 5 to 10 years, I don't know. I'll just tell you this. I just know that most insurance is replaced every 5 years. So the insurance company must expect it to last 5 years, right? Whereas the implants, if they do cover it, they cover it once in a lifetime. So that should tell you something right there. And I'll also tell you that typically, sometimes we do a lot of bridges, don't get me wrong. It all depends on the situation. Now, if you come in and you're 25 years old and missing a tooth, and you got sufficient bone, I'm going to try and advise you to go with the implant, because it can be the most predictable, longest lasting scenario for you. But if you come in and you're 95 years old and you're missing that one tooth, and the one next one broken down, and the bone's not very healthy, we may suggest a bridge. So the cost of something like this might be about $3,000 for a bridge. Ballpark. If you have our Smile Protection Plan, you can get 10 to 20% off that. So maybe as little as say $2,400, $2,500 if you have the plan. So this is what we do with a bridge. We have to shave down the adjacent healthy teeth. Now, don't get me wrong, if those teeth need crowns to begin with, then maybe it's the best thing to do. That is a fixed bridge. It looks natural, it feels natural. Not a bad option. So now let's talk about the gold standard, implant. So implant, it looks natural, It's the only option that stops bone loss. So what happens is once the implant goes in, it kind of fools your body into thinking the tooth's back in there. And it stimulates the bone. The stimulation of the bone preserves the bone from resorbing anymore. It replaces the missing tooth without damaging healthy adjacent teeth. It'll be the strongest tooth in your mouth. You can chew anything with it. It's not susceptible to further decay or gum disease. It's the most secure, predictable, longest lasting, stablest option. So the cons for it could be a little more costly and takes longer to complete. So let's look at that cost-wise. Okay, so we talk about the bridge might be about $3,000 on average, and it could be a little bit less if you're on your insurance plan or you have a smile plan. But I will tell you that we kind of try to make it easy at the office. So here's what I'll tell you is this: is if your bone is in good condition, say you don't need to pull the tooth out, we don't need to graft the bone back in there. And let's say that you just come in and you have good bone there. It's typically our practice to charge the same for an implant as we would a bridge. We're trying to take the price out of the equation. Now, most places you go to, the implant's about probably 50% more than the cost of the bridge, or at least maybe not 50%, maybe 25 to 50% more. So we just try to say, look, you go come in and get an implant, if all things being equal, meaning and you have sufficient bone, we're going to charge you the same price for the implant as we would for the bridge. So we just try to take that scenario out of the equation, saying, you know what, we don't want cost to be, all things being equal, we don't want cost to be the biggest factor here. Now, if you're missing a lot of bone, we got to graft a lot of bone in the area, or we got to extract it, preserve bone, it's going to be more expensive. But relatively, not really. The implant will be cheaper. Even though it costs more in the beginning, it'll be cheap in the long run, because I told you, not over 95% success rate after 10 years. So if you get a bridge done, let's say you get a bridge done, studies show that a 3-unit posterior bridge, after 10 years, it has a success rate of about 65%. That means about 1 in 3 have an issue after 10 years. So what happens if you get decay into that bridge? You got to take the bridge off, get a root canal in the tooth, or if you lose a tooth, now you go into a bigger bridge. It's an escapade that kind of, it's a domino effect. It goes worse and worse and worse and worse. So, yes, it might be a few $100s or $1,000, whatever, $1,000 cheaper in the beginning with the bridge, but long term, the implant's much cheaper, because 10 years from now, odds are it's going to be functioning just like it did the day you got it, and there's a 1 in 3 chance after 10 years that bridge is going to have an issue with it. And now you're reinvesting in that same area of your mouth. So you kind of look at it that way too. So when I look at it, I think actually, even though implants even are a little more expensive in the beginning, in the long run, it's by far the cheapest, most predictable, longest lasting option. So it may take a little longer to complete. So you may say, well, how much longer? Because if you get a bridge, we have the ability to make you a bridge in one day, in some cases, with that sewing machine that Stephen showed you earlier. And even so, if we don't make a permanent bridge that day, you can leave one day with a temporary bridge. So that is quick. I can't tell you I can give you an implant today. I know you may see these commercials saying, you can come and get teeth in a day with implants. Well, I don't know how successful or how predictable that is. I look at, sometimes I would like to say, let's give up a little bit on how fast you can get something for the sake of predictability. Because, yes, I have many, many cases where we came in with groove teeth, put implants, put teeth on right away, and they're successful, but not 98% successful. Because anytime you put something on those implants right away, there's more chance for it to fail. So, again, depending on the situation, we may or may not be able to immediately load something. So I should just ask Mr. Don to stand up, smile, or Steve to stand up, smile, and say, which one's the implant? I don't know. Don said himself he couldn't tell. He had to look in the mirror and say, okay, which one's the implant, which one's my teeth? All right, so. But I'm not sure I remember our wedding day. It's love. So let's talk about if you have several missing teeth. So Several missing teeth. What are my options if I have several missing teeth? So we talked before about the partial, or the flipper, and this is something like we showed before, but instead of having one tooth, it's multiple teeth. Again, the benefit is that it's most economical. When you're talking about something like this here, maybe it's about $1,200, $1,500, something like that. So it is the most economical to replace all those teeth. But the negatives are that, again, the bone loss continues because this partial is resting on the bone. When you chew on it, put force in the bone, resolving more bone. It's uncomfortable. It can irritate your gums. It moves and shifts when you eat. Again, the clasp wear down the adjacent teeth. It's removable. Take it out at night. Lifespan 5 to 10 years, and they can trap food. So now we get to more about implant stuff. So we have more options. You know, we don't have to just put an implant and put one tooth on there. Many times we do something like this here. Let's say you only have 6 teeth in the front and you want your teeth in the back. Well, this can be very economical for someone who has a partial. And it's not working for them. So what we can do, these are actually mini implants. We can put a mini implant, one on each side, make a partial with no clasp on them, and that partial snaps onto the implant. So the benefits are that it does stop bone loss, but only in the area where the implants are. There's no visible clasp involved, so it's not like people with these partials, they got these gold clasps or these metal clasps hanging on their teeth. Just something like this here, there's no need for any clasp because the partial is held in by these implants. You get increased functioning comfort. A lot of times you can use the existing partial. It's not quite as good as implant teeth like Don and Steve have, but it is much better than the previous partial they had. It gives them increased stability, decreased moving and shifting while eating. But you do have to remove it. Take it out at nighttime, let your gums breathe a little bit. Doesn't stay in all the time. Or at least not supposed to. We can do an implant bridge. So these are something similar to what we did for Don and Steve, is that implant bridge. Now we don't have to place one implant per tooth. We're missing, in this case here, missing 3 teeth. We place 2 implants, one in the front, one in the back, and put 3 teeth connecting over that. Okay? This stops bone loss. It's very comfortable, very natural looking. It looks and feels like your real teeth. You can eat pretty much anything that you want, as Steve and Don could attest to. It's typically a once-in-a-lifetime solution. Very stable, strong, and functional. It's in there permanently. Never comes out. It does cost a little more, and it does take a little more time. But it all depends on how much you value having what your real teeth would be like there. Yeah, so cost is a relative term, right? It all depends on how much you value that. You could put a single tooth for every implant. Okay? That can get a little expensive if you have missing multiple teeth. And typically, we'll make that recommendation based on how strong the bone is, how much bone you have. And if you feel, hey, you know what, we don't have to have, if you're missing 3 teeth, you put 2 implants, not 3, we'll suggest that for you. Or if your bone seems real weak and maybe not as thick. So there's a couple things to look at. One is bone quantity, and how much bone you have, both height and thickness. And second thing is bone quality, or how